How's it going, everyone? This is Brad Williams with Over 40 Fitness Hacks. I have my new season co-star with me, Dr. Ken Zweig. How's it going, Ken?
It's going great, Brad. Thanks for having me on.
Absolutely. Thank you. So, yeah, Dr. Ken is a general internal medicine doctor who also specializes in some behavioral change. And usually for our first episode, my audience always knows that we kind of dive into how you got to where you are the last 10, 15, 20 years. Whatever you want to throw out there, Ken, and I'll let you take it away.
Okay, thanks. Yeah. So it's a lot to cover for the last 20 years. A few things in that time. But yeah, so I just going back even farther than that, I'm originally from Pittsburgh, Pennsylvania.
Very
And
cool.
so big Steelers fan. And then went to school for undergrad at University of Michigan and then Ohio State College of Medicine for medical school. And then came to DC, which is where I am now for my residency at Georgetown. And now I still teach there and at GW for the students. And since then, I've been doing primary care, so outpatient adult medicine, also known as internal medicine, and just taking care of patients, focusing mostly on preventative care. And, this is something I've always wanted to do. It's sort of in my blood. My brother's a physician, my father's a physician. And I tried to escape that and go into the business world for a little bit and see how that worked for me. And this just pulled me back in. I'm a purebred. This is what I was made to do. There's no escaping it. And I love it. And so
See, I'm the opposite. My dad went into the medical field and tried to get his two sons, one of us, to do it, and both of us did totally opposite things and went for business.
But yeah, no, but so I absolutely love it. And the way I've got into behavior change is because I do primary care, because I do preventative medicine and treat chronic medicine, chronic conditions and things. And I realized after 20 years of taking care of patients, I learned this a little bit before, but I realized that, we don't learn a lot of behavior change in medical school.
Yeah.
They sort of say, hey, you should tell everybody you should exercise, you should eat right, and you should get plenty of sleep. And they sort of move on after 8 seconds of that onto what kind of treatments they should give. We should give people. And it's sort of an assumption in medical school that nobody's going to be able to do the changes that they need to do. They just figure everyone's coming to us because they failed at that. And so here's a pill.
Yeah.
And I don't like that approach. It's not.
I don't
think
either.
What people want. It's not what they should get. And there are ways to motivate people. Me just saying, "Hey, exercise." That's not going to get anybody to do anything.
Yeah.
Everybody knows they should exercise. Everybody knows they should eat right.
Well, that's what also keeps me in my profession is everyone by this time kind of knows what they need to do, but they need the accountability and the push.
That's right. They know what they need to do. They just don't know how to get themselves to do it. And so I started realizing that, 90% or so of the things that I see in my office could be prevented if people were better about doing the things they need to do, or society was better at pushing them, or however, whatever it is, a lot of these things are preventable. And so I started doing some research and realized that there are things that we can do to help people make the changes that they should make and give them a little nudge in the right direction. There's no secret sauce. There's nothing that's going to absolutely change their life like that in an instant, but certainly can give them a nudge in the right direction and really make it easier for them to do the things they need to do and not start with a pill. And so that's how I got interested in this.
And how has it been the last few years with COVID and everything? Everything going online, and were you able to jump on that bandwagon like the rest of the society?
Yeah, I was really great. I actually started with a new practice about a month before COVID hit.
Oh, wow.
So there was a bit, I guess I was clairvoyant in that respect because, I came from a big hospital system that was just a massive battleship that could couldn't make any turns or move or pivot in any way, to a much smaller practice that could pivot on a dime. And as soon as COVID hit and everything was shut down, within 2 days, boom, you guys are online, ready to go, doing telemedicine. We could do it from home, we could do it from our office, and it worked out great. And actually, we're still continuing to do it, even though we see people in the office on a regular basis. But people are busy, nobody wants to come in. But if they're at their office, they're at home, and they want to get seen, we can do a telemedicine visit, and it's actually been a lot more effective than I ever thought it would be. We've been talking about it for years, doing it at my old practice. And we said, yeah, we should do it. Yes, we should do it. And we just never did. And then when it came online, finally, you learn tricks and bits of the things that you can do, but it's a lot. It's still not the same as seeing somebody in the office. There's certain things that you certainly can't do, but there's a lot more that you can do than I ever thought.
Yeah.
So it's worked out.
Well, it just kind of brought all of us in every profession to the scalability factor. However we were doing in our local areas, for me here in Orange County, it was already kind of a dying gym business, and just too many competitors, and people were already doing social media. Fitness influencers were already taking them out of the pie, and it was already pushing us into the online world. So it basically, for a lot of us trainers who made it, forced us into the online and I started this podcast. I do online training as well. And it's almost better value of my time. I work less days now than I did before, and I'm happier. And I get to meet awesome people like you doing the podcast. And
that's great.
Yeah, it's just been awesome.
No, absolutely. I call it a COVID keeper. It's just something that it was forced upon us, and COVID hasn't been the best, but there are certain things that are coming from it that actually are really force things to the forefront that are worth keeping around. So
absolutely. Yeah. And now are you looking for the telemedicine part? Are you looking for any clients nationwide, or you kind of stick to Virginia?
Well, it's interesting because, most of my patients are close by. I'd rather not have, national patients because, there are things that you have to be seen for. And every once in a while they should come in and, I want to listen. I can't listen to the heart, or your lungs over telemedicine. You can't draw blood. You can't do an EKG. I mean, there are limitations. And so preferably we mostly keep people who are in the area. However, a lot of patients around here in the DC area, they're very, mobile people. I talked to somebody last week who was in Poland helping with the refugee situation.
Wow.
Medical question. I have patients who go for the summer to Montana or to Massachusetts or Florida in the winter, or Colorado for skiing or whatever. And so the nice thing about the telemedicine is that, they can still stick with me. They don't have to go to some urgent care or somebody that they don't know unless it's something that I can't handle. But so it's made for a nicer continuity, even if people are mobile and moving out of the area, which people are very mobile these days.
Yeah. Oh, that's awesome. And awesome they can get a hold of you that way too.
Yeah.
So cool. Area. I agree. So Dr. Ken, how does my audience get a hold of you, more for the, behavioral change and sleep disorder? Sure. Is there a website, or do you have anything they can download, or?
Sure. Yeah. So the best place to go is to my practice's website on NVA. So that's N as in Nancy, V as in Victor, A as in Apple, familypractice.com. Okay. So it's all one word. And on there, if you go to the media section, I have a blog there. We have a lot of videos, something called a town hall that we do about once a month on all kinds of different subjects. So we try to keep our patients as informed as we possibly can.
Okay. And then send website if they want to book a session with you, or?
Sure. Yeah. That's the best way to find us. Yeah.
Okay, cool. And my audience always knows that I, throw all that in the podcast details so they can just click the link instead of trying to, remember that, type it in.
That's great. Good. That's much easier.
Yeah. But yeah, no, sleep is very huge in my world too. And then it's the most looked over aspect of it. Everyone wants to do the bodybuilding, working out, which, nutrition's even more important than that. And then on top of that, sleep, and no one's doing anything with that. So it's great that there's people out there like you that are putting more light on this and get us as healthy as we can be.
That's the goal. That's my idea. So,
that's it.
That's great. Yeah, I'm glad you're doing it too by bringing it to light with podcasting, making sure that everybody, just gets the information first. That's the first stuff is education.
Absolutely. Well, thanks, Dr. Ken. I really appreciate you being on the show, and we'll check back in with you probably sooner than later.
All right. Sounds great. Thanks so much. I really appreciate it.
Awesome.